Hello viewers, welcome back to another exciting and amazing heart-to-heart health chat show. I hope you enjoyed our last show where we discussed about an approach to palpitations, what to do and obviously what not to do. Today we are going to talk about a very important and interesting topic, that is cardiology in the emergency room. 911, when to call, why to call, what do they do at the ER that if you call your doctor in the office cannot do, or an urgent care center cannot do? Why should you go to the ER? And to educate us on this, we have our amazing Dr. Kusum Punjabi. Dr. Kusum Punjabi is an attending physician at Robert Wood Johnson University Hospital in New Brunswick. She is an assistant professor at Rutgers Med School, and she's my friend, my soul sister, and my buddy. Kusum, thank you and a big welcome to our show.
Thank you for having me.
So we're going to start off with our first, and in my opinion, this is the most difficult question, which is, what are the challenges that you face in the ER when you are dealing with cardiac patients?
So Ranjita, one of the biggest challenges I think any doctor in the emergency department faces is when a patient comes in, they say, this hurts, right? This could be anything. Exactly. It could be the heart, it could be the lungs. Our food pipe is here, so simple thing like reflux can present like that. It can be a blood vessel called the aorta that can be damaged. It could just be muscle pain, right, from carrying heavy bags or lifting out in the gym. So that is one of the challenges of an emergency doctor. When a patient says, this hurts, and they point to the chest, what exactly is hurting and how much is it hurting?
Exactly, and that's so appropriately answered. And what I think also is sometimes the pain can be so severe and the anxiety component comes in.
Yeah.
And just to get the exact pinpoint history as to where is the pain takes you a little while.
Yes.
And that's sometimes the trickiest part, because you may be dealing with something really serious where you have a tear in the aorta, which is an immediate surgical emergency, or you may be dealing with a heart attack, which is also a cath lab emergency. So
of course,
which way to go? Should we just jump on the patient and say, okay, chest pain, chest pain, chest pain, or say, calm down, tell us more? So again, in a busy ER, I'm sure that's very difficult to tackle.
It's actually very difficult because I'll give you an example of a case I had the other day in the ER where a patient was driving the car got into a car accident, the airbags hit the chest. Now this patient was extremely anxious, nervous, had the seat belt and the car, the steering wheel hit them on the chest, and on top of that they were having a heart attack.
Oh my God.
Now imagine if this patient comes into the ER with chest pain. Which chest pain is this? Is it from the anxiety of the car accident? Is it from the steering wheel that hit the chest and the airbags? Or is it from a heart attack? So you're right. As an emergency doctor, I was literally sitting there and I'm like, I got to check for everything and make sure we're not missing anything. And that's the challenge when a patient says there's chest pain here.
Patients sometimes ask me these questions, and I think, let me hear your perspective too. When should patients go to the ER when they are worried about whether they're having a cardiac event?
That's a great question. So you never know when you're hurting in the heart versus when something is just non-heart related, right? Exactly. It's very difficult for even a physician to say that. So for example, if somebody has pain anywhere in this chest wall area, we often ask them to ask themselves this question: could it be something I ate that's causing reflux? Right. Could it be that I was in the gym and working out, and if I press on my chest, does it hurt? Could this be muscle related? Or could this be heart related, where you start sweating? Sweating in the summer or the winter is never good. It's never good to sweat. So whenever somebody starts sweating, or if they start having pain when they're doing exertional activity, that is not, as we tell in medicine, reproducible, which meaning when you press on the chest, you don't feel it. Right. We tell them you must come to the ER and get checked out for it.
Patients sometimes present to us to the same questions. The doc, when you're not in the office, when should we go to the ER? And sometimes they hesitate to call us after hours. They don't want to disturb the doctor at night. And I tell them it's always better to be safe than sorry. I mean, worst comes to worst, they will say, oh, everything is fine. It was
Right.
just indigestion or you pulled a muscle.
Right.
But at least you can go home and sleep and not worry about, gee, did I have a heart attack or did I have something else going on? And you don't want to be that case that never woke up next morning from sleep.
Yes.
Okay? So our next question at this point is, what are the advantages of coming to an emergency room versus going to an urgent center or a doctor's office?
That's another great question, because I really want this message to go across to the viewers.
Right.
When you come to an emergency department, immediately everything is done stat.
Exactly.
Stat meaning the blood work is done stat, where we look at these enzymes that are released by the heart under stress, which go straight to the lab, and within 60 minutes we get the results.
Exactly.
We can also call cardiology stat. So if as soon as you walk in less than 5 minutes of you being there, we can do an EKG. The EKG is a picture of the heart. The moment the emergency doctor looks at it, and if it shows a heart attack, I can call the cardiologist right away. And all cardiologists, we have them on cell phone, they can come from home, or we have cardiologists in the hospital ready to see the patient.
Right.
So it's a big advantage of coming to the emergency department versus an urgent care. Now, if you go to an urgent care, which we see a lot around, right, like Med Express, Brunswick Urgent Care, City MD, these are all common names of urgent cares in the area. If you go to an urgent care and they see a heart attack, they're calling 911,
Right.
the ambulance, to bring you to the ER. If you come straight to the ER, we can take care of you right away. Plus, we can give you medications right away. We can put an IV line and give you IV medications right away. So I'm really a big proponent that if you're having pain in the chest area, especially you're above the age of 35, and when you press your chest and you're not feeling the pain, it's something more internal, you must come to the emergency department to get seen and evaluated for it.
So very true. And I completely agree with you that if you're having chest pain, do not hesitate to go to the ER. And again, I agree with you. Immediately you can get the EKG, any lab stat, which means that it's drawn stat and you can get the results right away. The other advantage is, in cardiology, we talk about this thing called time is muscle,
Yes.
which means that the quicker, if there is a blocked artery, we can open it up, we are saving the muscle of the heart. So
Yes.
if you go to an urgent center, they tell you, okay, we need to call 911, go to the ER, you are losing time.
Yes.
And you are at danger of losing cardiac muscle.
Actually, viewers should know, and we should just let people know in general, the door to balloon time, meaning from the moment you step into the ER to when you make it to the cath lab and the cardiologist has started the evaluation of the actual blood vessel, is 60 minutes. So you have 60 minutes to do that. So you really have to move, and it's best if you show up to the emergency department where we can make things happen very quickly.
Exactly. Agree with you. Time is muscle and the door to balloon time. And actually, doctors in the ER and cardiologists are monitored for the 60 minutes door to balloon time, and we are expected to maintain that nationwide. We are now going to talk about whether treatment can be expedited on cardiac patients even before they present to the ER. So let's first talk about how do you treat patients in the ER with heart attacks.
As soon as a patient comes into the door complaining of chest pain, immediately, and less than 5 minutes of them saying that, an EKG is done. An EKG is a picture of the heart. It shows us where the electricity is going, and if the electricity is not going the right way, we worry about blockages in the heart in those blood vessels. As soon as the EKG is done, an emergency doctor looks at it, and if the EKG shows a heart attack, immediately we activate what is called code heart attack in the hospital. This is done at all big hospital centers around the country, and it's a very standard practice of care.
Right.
The moment it's announced that there's a heart attack in the hospital or in the ER as a patient, the cardiologist is called. The cath lab team, which is the entire group of nurses and staff that works in the cardiac catheterization lab, comes to the ER. Literally an elevator is blocked so that that patient can make it to the cath lab in less than 60 minutes. And we start the medication treatment for the patient in the ER. So for the medication treatments, we give them aspirin, we give them IV pain medicines, we give them other medications to just make sure the heart is not working extra hard
Exactly.
when it's already blocked.
Exactly.
So all these treatments are done, and our goal is that in less than 60 minutes, that patient makes it upstairs to the cath lab.
You know, Kusum, it's so interesting. Up until a few years ago, this door to balloon time that we are talking about, where a patient presents to the ER and they're taken to the cath lab where the artery is opened up with a balloon, it used to be 90 minutes.
Yes.
And now it's been changed to 60 minutes because research has shown that the earlier we open up the artery with a balloon and a stent, the mortality or the outcome of the patients are much, much better.
Yes.
And we are so lucky to be practicing in an urban or a suburban setting where we have access to a cardiac cath lab 24/7, where patients, when they're presenting with acute heart attack, we can wheel them right away for an angioplasty to open up the artery. But in remote areas where they do not have a cath lab, what do they do when patients are coming in the ER, where the hospital is a small hospital, small ER, the cath lab is like an hour away? Can you tell us how you deal with patients with acute heart attack in that setting?
So, Ranjita, that's a great question. I would advise all viewers to do two things. One, look around where you live and where you work. What is the nearest hospital that has that's called a level 1 trauma? Level 1 trauma meaning they have a cardiologist there 24/7. Just to know, so you know around your home or your work, where could you go if you're having a heart attack? The second thing to know is if you're ever having chest pain, don't try to drive 20-30 minutes to get to that hospital, right? As you keep saying, time is muscle. Muscle meaning heart muscle, that your heart has to be saved within 60 minutes. So people in general should go to the nearest hospital. Now, there are a handful of hospitals in the country that are considered level 1, where there's a cardiologist 24 hours just sitting over there ready to see a patient. Most hospitals are actually not 24 hours. You have to call the cardiologist from home. Those hospitals are called community hospitals. In such settings, when the patient gets there, the emergency department, we ourselves are the ones that give the patient the clot busters. These are essentially medications that break the clot. And once they break the clot, we then transfer the patient to a higher hospital.
So in those lines, can you just educate us, what do you mean by clot busters?
So in general, when someone's having a heart attack, think of your body and your heart having pipes. And now the pipe is full of some sort of dirt or crud, which we call cholesterol or plaques, which is blocking the pipe. So you want the pipe to be empty and clean. If there's a clot or some sort of cholesterol in it, that clot has to be removed. Otherwise, that muscle or that area is not getting blood, right? That's a heart attack. So essentially, if we're waiting for the cardiologist to come from home, because a cardiologist can go in and literally like a plumber remove that clot and put a stent, as they call it, which looks like a Y. We essentially give the patient medicine to break the clot. Kind of how we do Drano when we're cleaning our pipes at home in the kitchen. It's kind of like Drano. Now that Drano is called clot busters. It comes in an IV form where through an intravenous line in the vein, we give the patient a medicine, or we can give them tablets now. But that tablet has to, or that IV medicine has to be given with an emergency doctor watching you. Because this medicine, when it kind of goes in like a Drano to open it, you know how Drano is so strong in the plumbing? It's also very strong for the arteries of the heart. So we have to make sure the patient is getting the right dosage, the right amount, they're tolerating it, they're not getting an allergic reaction to it, so that's what it is.
And also they're not bleeding out from it. That's one of the other things.
Exactly.
So again, in the lines of this clot busters, you know, there is research going on where we are trying to see whether these clot busters can be given when EMT arrives and sees the patient is in acute heart attack. What are your thoughts on it?
So that's a great question. You know, I've often thought about what can a paramedic do at the scene? And honestly, it is great if they can give the clot busters. Because our patients, really, we want them to get treated right away. And I want patients to know and viewers to know that every emergency ambulance that comes to their home or to their work to come pick them up, they actually call the ER and they talk to us. We can see their EKGs in the emergency department. So if they call me and they say, Dr. Punjabi, there is a patient here with severe chest pain and this is the EKG, I can give them instructions on the phone, what medicines to give. So by the time the patient comes to the ER, I'm ready to see them, ready to send them to the cath lab, or ready to call the cardiologist to receive them to start the treatment. So the treatment, that 60 minutes clock, starts right from when they're coming to the ER. So actually, I'm in big favor of it. I think our paramedics, our EMT, these are the medical professionals who drive the ambulances. They all get trained in this.
Absolutely.
And once they are trained, they can definitely work with us, with the emergency doctors, to supervise them and make sure the patient is doing well right on their journey to the ER.
Exactly. And in those lines, once the clot buster is given, the artery probably is partially opened up, and that relieves the chest pain and the distress that the
Right.
patient is in.
Right.
So I think that would be a great thing, because we see amazing emergency medicine technicians, EMS people who are very, very well trained, and they put patients on ventilators.
Oh, yeah.
They save lives.
Yes.
And this is also such is a life-saving thing.
Right.
So I agree with you completely. I'm completely in support of that, and hopefully one day they will be starting the treatment when they see the patient in their house having an acute heart attack. Give them the clot busters, bring them to the ER, and take them to the cath lab and put in that balloon and a stent. That would be amazing.
That
right?
would be amazing.
But that means that the door to balloon time will decrease further to probably 30 minutes, right?
Right. Which would be awesome for the patient, right?
Again, time is muscle. Don't forget
Right.
that.
Right.
Tell us some interesting cases that has left a lasting impression on your mind.
So, one of the cases I think I'll never forget is of an Indian lady actually, who was approximately 8 months pregnant. And she was in the mall, nearby mall, going for a walk. And, she started getting very short of breath. So she went and saw her doctor, and she said, she went straight to the doctor's office and told them, I'm having severe shortness of breath. And the doctor said, oh, you're pregnant. The belly is pushed up when you're pregnant. So you're not taking deep breaths. So that's from that. It's expected in pregnancy. In less than 12 hours, the breathing got worse. She tried to sit on the couch, she couldn't breathe. She tried to lay flat, she could not breathe. She could not get comfortable. Then she started sweating a lot.
Wow.
Like we
That's a bad
discussed
sign.
earlier, whenever you're sweating, it's bad. Sweating is never good, not in the summer, not in the winter.
Completely agree with you.
So then she came to the ER. Luckily, she came to the ER, because when she came to the ER, she was having those changes on the EKG that we see when someone's having a massive blood clot in the lungs. You see, when you're pregnant, the body sees the pregnancy as a foreign object, like doesn't belong to us. This is something different than what we
Right,
have.
right.
So the blood starts clotting much quickly. So kind of how you get in heart attacks, the cholesterol clots, like that, you can have clots in your lungs from the pregnancy. That's why women who are pregnant are told to go for walks, check and see if they can breathe. So this patient was having actually a massive blood clot in the lungs, and it showed on the EKG. The moment we saw that, we right away did all the actions that we had to take to save this patient's life. And I'll tell you, if she wouldn't have come to the ER, she would not have lived. So, I'll never forget that case, because we moved very quickly in the ER, got the cardiologist to see her, got the pulmonary doctors to see her, were able to give her the clot busters to break those clots in the lungs. And again, it was chest pain and shortness of breath that brought her to the ER.
Wow, amazing, right? It's these kind of cases you will never forget, and the way the ER worked to get this patient better, and I'm sure she delivered the baby okay, and she did well, right?
Yes.
So similar situation where I was involved was another pregnant lady. She was actually a nurse at I think in Robert Wood, and came to me with chest pain, and it was a very atypical kind of chest pain, and she said that she has been to multiple doctors. Everybody said nothing was going on, and it just did not feel right. So I said, can you go to the ER? She said, I've been having this chest pain for a while now. Do I really need to go to the ER? I just said that, I just don't have a good feeling about this. Sent her to the ER, and I said, what? She is a young girl. I don't think she's having a heart attack, but just check her out. They did a CAT scan. Thank God she had an aortic dissection.
Wow.
And it was a slow dissection happening, which means it is like a tear in the aorta, which is the big vessel that comes out of our heart, like the trunk of a tree, and then give branches to the rest of our body to supply the blood. So in this young girl, because of the hormonal changes in her body, her aorta had become a little bit thinner, and what she had was a little tear. And because of the hormones and her physiologic changes, the tear was slowly expanding and going through the layers to almost like a full dissection to almost a rupture.
Wow.
So if I did not send her to the ER that day, it would have been a life-threatening event for her, and we may even have lost her.
Right.
So she delivered the baby okay. They were able to take her to surgery. They were able to save the baby. She went through a full-term pregnancy, and she still walks into my office. So these are the cases that you will never forget, right? But these are also learning points for viewers, where if you are having problems, don't hesitate to go to the ER and get yourself evaluated. You may be waiting for a little while longer, because I understand the ER is busy, you have other stuff to do, but again, health comes first. Your life comes first. And then you will see that after everything comes out to be normal, it will give you mental peace, and you can go home and sleep at peace. So Kusum, let's hear about another interesting case.
So another case that I'll probably never forget is of actually an Indian man who went for a wedding. Now, you know how when you go to wedding receptions, especially an Indian wedding reception, you eat such amazing rich food, right? Malai kofta, rice, desserts, drinks. So this patient had all of that, and around 9:30, 10, he got to his house, and he started having burning pain in the middle of the chest. He took a Tums. Another 30 minutes later, he took another Tums, not getting better. Meanwhile, his wife went to bed. They were already home. They were relaxing. He couldn't sleep. He was trying to rest in bed. He just couldn't sleep. So he woke up. He walked around a little bit. He said, let me see what else to do. He had some warm water. Then he took some warm water and put some salt in it and drank that. All the different remedies that we are taught from our parents and our grandmothers of things to do when you feel reflux or pain in the chest. And it was like a burning sensation that he was having in the middle of his chest. But he just couldn't sit down. That made him call 911 and come to the ER. Now, I want people to know that we don't take chest pain lightly, right? If anyone ever complains about chest pain, in any emergency department in the country, we take that very, very seriously. So the moment you come in, we do an EKG. The moment he came in, we did the EKG, we saw it was a heart attack. I remember going and telling him, sir, you are having a heart attack. And he's like, no, I just had too much greasy food. I said, no, sir, you are having a heart attack on the EKG. And instantly, we moved mountains to get him to the cath lab. That case I will never forget, because often we think that it's just reflux and we take medicines and say, oh, it's nothing. But if this man had not come at the time he came, he would have died.
Kusum, thank you again for joining in our chat show today.
Thank you.
Not only was it great to chat with you, because you're my sister, but also we heard too about what you do, saving lives in that ER, about the interesting cases.
Great.
Viewers, thank you for joining us. I wish we had more time to listen to those interesting cases that Dr. Kusum Punjabi was telling us, but we will have more things for you coming up. We will be back next week. We will be talking about diabetes, a very, very important condition. We will educate you on what to do when you have diabetes, what to do so that you don't have diabetes. So don't forget to join us. Bye for now.